in the next 20 years you're 80 and still, so most we will not want to do that. Not, some early 50s who can do, but not 60.
Wow. Okay. I am AS and my partner is AS too. Please, can I do IVF?
Yeah, you can, and that's where
PGD.
pre-genetic diagnosis comes in.
Okay. Please, can someone of 40 years do IVF? Yes. Someone who did hysteroscopy last year, we should do IVF by next year. I think she should be needing another hysteroscopy.
Well, possibly, yeah.
Okay. All they ask here is how much they want to know. Give them. You want to know how much?
You can tell them.
Okay. Yes. Emanuela, explain more on what. Please complete your question. Please, how much is I have an selection? Someone who did. Someone who did hydro what? Help to make me. Help me. Someone who did hydro circuit.
Yes.
Okay.
So maybe she would have had a tubal ligation, and then so we want to know how the uterine cavity is.
Okay.
Yeah.
If you check it out, all you'll be seeing is when is the next promo. Everybody wants to know when the next promo is. So if you have any more questions, please drop it in the comment section, okay? No, you never do. When is the next promo? Good morning, so good to meet you on live today. Remember me? Jocelyn from Canada. Next promo. It's early next year. Oh, he already said it. Early next year. So just give them 10 more minutes. I'll end the live and then I'll make a video that I can edit and post, so that anybody that didn't meet up with the live can watch it. Yeah. So this is 3:16. The next 10 minutes. I don't want promo, please. She wants the actual price. What about what about someone that is not in Nigeria? So how do you treat people who are not in Nigeria?
So for those that come, the diaspora patients, we have a lot of them coming, and so when they come, we of course before they come, we would have had contact with them. They would have given us their various logistic arrangements and all that, and then we would have had some prior history from them. We want to, since they are not resident here, we want to know, take their last menstrual, their history, their gynecological history generally, and also the investigations that they have done abroad. So by the time they come, we review them. Those that we also update those investigations, and then we go ahead with the treatment. If we need to do hysteroscopy here, we do here, and then if we need to carry out any other investigation, we also do that, and then we commence that treatment. So we've had, a lot of people coming from diaspora, and they've also had good results.
Okay, this one is asking, please, how long will your hysteroscopy take to heal before any IVF procedure?
Once we do the hysteroscopy, by the next cycle. We should start treatment.
Is pregnancy for women over 50 possible?
It's possible.
It's possible, okay. Please, I want to come straight to the hospital from Canada now because I'm seeing the doctor online. Please come, A lot of us are coming. Please, you people should come, and go with your positive results. Good afternoon, doctor. For someone whose sperm count is not that high, I don't mean as a spermia, can ICSI be done for such? And what's the cost? Forget about the cost.
Come again. I didn't get that question.
Okay. For someone whose sperm count is not that high, I don't mean as a spermia.
Oh, no, ICSI can be done.
ICSI?
Yeah, we do ICSI.
Okay. Okay. I'm skipping most of the questions that are not, like people asking the prices of hysteroscopy and laparoscopy. So, people are asking, what's the success rate? I think it's the same thing generally.
Generally, yeah. So, I mean, IVF is not, as I said, it's not guaranteed. And, I mean, it could work, it could fail.
Yes.
So, this is not to tell you that it's 100%.
Yes.
You don't want to do that, yeah.
What brought me here is the promo price. They want to know how much for the promo. Okay. Okay, doctor, thank you very much. Please, I need the contacts of the hospital. Please, anyone that wants the contacts of the hospitals, drop me a message. I will send you the number that you used to contact the hospital. I've been sending it to a lot of you, so just drop me a message. I will send the number to you. Okay.
Greencare.
Yes. How long should I prepare to spend in Nigeria for the procedure till a positive result? And if it fails, and if it fails, how long before you can try again?
Okay, so between 4 to 6 weeks, 4 to 6 weeks, having given us your history, your investigations that you have done, so between 4 to 6 weeks, and we hope it works. However, if it fails, I mean, you can try again.
Within how many?
Try again. By the next cycle or the next 2 cycles, you can come back.
Okay.
Yeah.
My husband is AS and I'm AC, and we want to choose the IVF option.
Yeah, that. So you can do a PGT, pre-genetic testing. Yeah.
Okay.
Yeah.
So a lot of people are asking if you have branch. Please, it's only in Port Harcourt for now. For now, maybe later. Any branch in Lagos, any branch in Ghana, no branch for now. Please, I want contact. Drop me a message. I'll drop the hospital contacts for you. I want to come for my IVF soon. Is it advisable to take supplements? I don't know why people feel like taking supplements. I don't know, Sha. I don't know if it helps.
We recommend that you go for a gynecological review.
Okay.
Any good gynecologists, go, let them review.
Because most of them used to chat me and they'll be like, I'm taking vitamin E, I'm taking vitamin C, I'm taking cocoa 10 and the rest.
Yeah, so there are different supplements that, everything. Some people may have. I just saw a patient, was it today? Yeah, today, that has testicular failure, and he says he's taking supplements. So you see, there are certain. That is why it's always good to be reviewed by specialists. So wherever you are, get your gynecologist and let them review you, and they will be able to tell you exactly what to do. That's it.
More than 300 is watching from my end. Okay, please, what's the hospital name and location? May they hear from your mouth.
So
Okay. Yeah, I've been telling them, so let them hear from you. The hospital name and the location.
It's Greencare Medical Consultants and Fertility Center. So, as I said earlier, I'm the medical director, and we are located in Gumibu.
Yeah, number 15.
Number 15.
Baba Street.
Yeah, in Gumibu.
Okay. I'm afraid of IVF because I've done it 3 times. I will not be mentioning the hospital she mentioned in Port Harcourt here. She said it's failed. So the same thing the doctor has been saying, it can fail, it can work, it's not guaranteed. It doesn't matter the hospital you use.
Yeah.
Every hospital is the same thing. And I keep telling them, it does not matter. Does doing a PGT not affect the embryo?
No,
it's part of the.
It's part of the, you assess the genetics of that particular embryo. However, there are certain instances where the embryologist may, because you take a biopsy from that embryo, so whatever procedure or whatever process is hinged around the embryologist.
Okay.
Yeah.
Do you guys do the gynecological review in Greencare?
We do.
Okay. Just want to say that before the number, no booking. Good vibes only. Please send me a DM. Let me know the particular number you've been calling. So the data are funny. Oh. What about egg freezing? Do you freeze eggs?
Oh yeah, we do cryopreservation of semen, of course eggs and the embryos.
Okay.
We have that facility.
Yeah, number 15, Baba Street, you got it. I want to do it in November, but if people are avoiding the price, send me a DM. I'll drop the price list for you, okay? Please, if you have any more questions, drop it in the comment section, because this live, we are ending it in a few minutes. But if you want to see more of the questions, like you want to watch more of the questions and get answers to your questions, you will go to my YouTube page, Mom of Quadruplets. That is where you will find all the questions you've been meaning to ask him, because I'm going to ask him most of those questions. So you go to my YouTube page and watch most of them, okay? But for now, if you have any more questions, let me know in the comment section. Okay, this one says you should talk about ICSI.
So ICSI is intracytoplasmic sperm injection, and is like you can say an advanced form of IVF, where for those that have male factors means low sperm count. You could low sperm count is oligospermia. You could have oligospermia. You could have severe oligospermia. So it's a method where if the spouse's sperm is low, it's a machine that can help to boost the fertilization process, which under natural circumstances will not take place. So that's what ICSI is all about.
Okay. So this one is asking. Yeah, number 15, Baba Street, Rumingo, Port Harcourt.
Questions from Greencare.
Okay.
Okay. Someone said, I was asked to book hysteroscopy in your hospital. Please, I'm scared. Is it painful?
Well, we have some pains, but
Yeah.
of course we have analgesia that we give to prevent or to reduce or minimize the pains
pain.
that you have.
Okay.
Someone said, talk more about hysteroscopy. And then someone said, how can one book for consultation?
So hysteroscopy, as I said, is an endoscopic procedure where we visualize the inner wall or inner lining of the uterine cavity. So it helps to identify certain lesions that may be inside the endometrial cavity, such as uterine polyp, submucous fibroid, and also adhesions. So if we have any of these lesions, you can also carry out therapeutic hysteroscopy, from diagnostic hysteroscopy. That's what it is.
Okay, we have a question from your page, sir. It says, how long does any of the IVF take?
Yeah,
I mentioned
it, yeah.
4 to 6 weeks.
4 to 6 weeks. Okay. Would you advise a donor IVF at 48 years?
Yeah, of course. That is the essence of counseling, taking a history, examining the patient. So at 48, you find out that the ovarian reserve will be not very wonderful. So you may counsel the patient for donor IVF.
Okay.
Someone said, do you do PGT?
We've answered that. We've answered and we do PGT, yes.
Yeah. The doctor is so humble. He's my God sent. Amen. Yeah. Do you guys do surrogacy?
Oh yeah, we carry out surrogacy services.
Okay.
Yeah. For those that wouldn't want to, carry the pregnancy.
Sir, please pronounce this thing a bit. I have hypothyroidism.
Hypothyroidism.
Can I do IVF?
Yeah, so that's the essence of coming. When you come, we'll evaluate you, get an endocrinologist to review you and also certify you fit for the procedure.
How sure are you assuring me that the IVF is going to work?
I've already mentioned it's not a guarantee.
It's 50-50. In fact, 60-40. 60% it might not work. That's the honest truth.
Someone said, does IVF guarantee multiple pregnancies, that is multiple babies?
Well, I mean, you have most of the time embryo transfers are more than one. So if you see that in IVF, the outcome is usually maybe either it can be singleton, it can be twins, triplets, quadruplets, just like that.
Yes, so okay, this one is the same question. Do you do surrogacy? Yes.
Yes, we do.
When is the next promo?
It's only got now waiting for you. When is the next promo? When is the next promo?
Someone is asking how much for egg donor. I think the person means
Donor treatment. Okay. We are not discussing money here. After 4 miscarriages, no child, first time to try IVF, 1 fallopian tube, any risk?
Yeah, I mean, in any process there are risks. So there are risks, of course, and just for her to come for evaluation or be evaluated anywhere you can.
Okay. 3 times and it failed. She mean IVF. So
Okay,
IVF.
IVF. Yeah,
if I want to try again, is there any special package? Is there any special thing you advise her to do?
No, if it's following the evaluation process that we will know what exactly happened. Again, at times you may not also see anything, and that is how it is.
Okay, this one is asking how many embryos they transferred to me. They transferred 5 embryos for me and then 4 stayed. Yeah. Please, when it's safe for a CS mom to carry triplets?
Once you're healed now, once the previous surgery, everything is okay. That should take maybe in the next 2 years, 1 to 2 years, you should be okay.
Is a 40 years woman egg still alive?
We have to investigate.
Someone asks, can low sperm count be enhanced 100%, and how can one go about it?
100%. It depends on what is even causing the low sperm count. So if it's an obstructive cause that may require surgery, that can be done. But if it's not, if you have low sperm count, there are supplements, there are other drugs that can also be given to the person.
Okay. Can one with blood tubes go for IVF?
Why not? For IVF, you don't go through the tubes, through the fallopian tubes, you mean?
Okay.
So, but the most important thing is that the uterine cavity is normal.
Okay.
Yeah.
For someone that did frozen embryo transfer, it was successful, and 3 weeks now, when is this safe to start? I don't know for how. Yes, so. I usually tell them that their doctor will advise them best.
Well, it doesn't really matter. These things, it depends on the individuals that are involved. So they are individualized. For some people, they may not want to even touch their partner till 9 months. We don't advocate that, but I mean, some want to wait and let everything be okay.
Okay, we have a question from Nima. Nima, she says, please, I've been diagnosed with mild cardiomegaly. Can I get pregnant with multiples through IVF, or is there any risk?
So that's the essence of being evaluated by the internists, by the cardiologist and other relevant medical personnel.
Is it possible to have triplets if I want? This question, I used to tell them, it's not about the number of embryo that was transferred. It's about the one that wants to stay, because most times they might transfer, just the way they transfer 5 for me and then 4 stayed. Some other persons, they might transfer that same 5 and then they will end up with 1 or 2 or 3, depending. And I've actually seen someone that they transferred 1 and it splitted.
So I think in her own instance, I think there was a split, particularly a split in one of them. So maybe not 5. we don't want to transfer 5.
Yes. I think that was what happened. That was what happened.
We had 3 and then 1 split and then.
Yes. Yes. I'm happy to be here. I need to meet the doctor next year. We'll be waiting.
Can amniocentesis be done during the period of pregnancy?
Amniocentesis. Yes, it can be done at I think 11 to 14 weeks or so. But we are not doing it in this center. Yes.
Okay. Can you provide somebody that can donate egg for me? Yes, so if you want, come. We'll provide egg donor for you. For someone overseas that can only come for a short period, what can be done? Okay, the doctor already talked about it earlier. He said people that are not in the country, you can start your procedure over there. You will do most of your tests there. If you have to do hysteroscopy, you will do it there and then come maybe a few days before your cycle, because stimulation starts 2nd day of your cycle. So with that, it will be very short for you. Is it true if someone uses IVF, the person won't be able to do any work, like walking or bending down? Wahala.
IVF is, you know how...
Pregnancy is pregnancy.
Yes, pregnancy is pregnancy, and you know that the cost... once you do it and it works, you should be careful.
Yes. Even with natural pregnancy, you can still miscarry.
Yes.
So it doesn't matter whether it's IVF or not. I have 3 weeks, so I want most of the tests to be done there. Can 3 weeks be enough for someone that has done most of her tests there? 3 weeks.
We usually say 4 weeks.
4 weeks. Okay. Please, hospital address, number 15, Baba Street, Rumibo, Port Harcourt. How long will it take to complete IVF process for someone who is okay but just doing it for gender selection? Gender selection, I think it takes longer time.
Yeah, because of the pre-genetic testing.
Okay.
Yes, okay. No. After hysteroscopy, when is best time for IVF procedure?
The next cycle, you mentioned it earlier. Can someone with hydrocephalus go for IVF? I think you answered it.
We would have sorted out the hydrocephalus before doing the IVF, because so that the fluids won't become toxic to the environment.
Is IVF process painful? I think it does the injection part.
Yeah, injection and not so. It's something you can bear. For the OCR, when we are doing OCR, we give analgesics, we give painkillers. So it's not something that you can bear.
Okay. What about someone with irregular period that does not know when to expect period?
And that's the essence of the evaluation. We give oral contraceptive pills, and then that will not take over that period and know when the patient will have a withdrawal bleed, and then we now commence the process of either down regulation or stimulation.
Okay. So, how long does the pre-genetic testing last? How long does it take?
Usually between 6 to 8 weeks. Everything about it, about the IVF period, IVF procedure and PGT.
I think it takes longer time.
It's now getting shorter.
Okay.
Someone says, can I come for stimulation and try to conceive naturally? My tubes are open and I just want multiples.
You can.
I'm coming to Nigeria by December.
Okay. What happens if there was not enough egg from a lady of 35 years and she doesn't want to use donor egg?
Well, at times you could have a dilemma. So you count. That's the essence of counseling. When you do a proper counseling, you see that all these issues won't be there. So, counseling is one of the most critical aspects of IVF treatment, so that the patient or client will know that, oh, you can do this. And apart from beyond counseling, you do investigations. The anti-mullerian hormone level will tell you the ovarian reserve of these particular patients or clients.
Okay. How about someone who just took out a fibroid 9 months ago and the fibroid returned? Can she do IVF?
Yeah, she can, but I mean, that's the essence of evaluation. If you have a recurrent fibroid, for instance, that is in the submucous space, you will still want to remove it because it can interfere with the process of implantation.
Okay.
Okay, we have a question here. Said, since my husband will be back by January, should I still do my hysteroscopy this month, please?
You can.
Then someone said, what happens if you have done the transfer and you have tested positive later, around 10 weeks, but no embryo sac, but you test positive?
Wow.
Well, you could have a chemical pregnancy, and you could also have a missed abortion. These are all outcomes. At times, one could even have a ectopic pregnancy. These are all complications of IVF process.
Yeah. Is it possible to go back to overseas a week after your transfer?
It's possible. It's possible.
Do you help with that? Okay.
But we prefer our clients to have good rest. But after 1 week, why not? You can.
Okay. I have AMH of 0.93. I'm 42 years. Can I use my egg?
That looks low, and of course we need to look at the reference range of the laboratory, but generally that 0.9 looks low, and if it's low, that means we'll start counseling the patient for donor treatment.
Okay. Are you cutting out the fallopian tube if I have hydrocephalus?
When you come, of course we will evaluate you and then know the exact thing, either saprophyrectomy or clips.
Okay.
Yeah.
What's the name of the hospital? Okay, Greencare Fertility Clinics, located at number 15, Baba Street, Rumimbo, Port Harcourt. Can I pay for the procedure 3 times? When you come first, we'll know. What's the best number of AMH?
There's a reference range depending on the laboratory. I had said that.
Okay. Do you help with accommodation for someone outside the country? Yes. What of someone that has high BP?
So that's the essence of the evaluation, medical evaluation by cardiologists.
Okay.
Yes.
Doctor, please talk about the promo. It's only promo.
No, of course, these are medical, legal issues, and consent will be sought and all that, and from the couple, and of course, you also protect the donor too, and most of it is based on anonymity.
Yes, okay. Can my husband freeze his sperm? Yes.
Yeah, we do sperm freezing, cryopreservation.
Okay, I think, but after the freezing, when they want to use it, the person is expected to do it, right?
Yeah, yes, after cryopreservation.
Okay.
Someone says, what about someone with PCOS? Can she do IVF?
PCOS.
Yes, PCOS.
I don't want to use donor eggs, but my children has autism. I would like to do IVF, but her question is not complete. Does freezing comes with an extra cost? Yes.
It does.
Mm-hmm. Is accommodation possible for us? Yes, so accommodation is possible for people abroad. Even if you are in Lagos, Abuja, accommodation is here, but accommodation is not free. You have to pay for the accommodation. Is there available donor egg banks? Yes. So if you have any more questions, please drop it in the comment section. We'll have 10 more minutes. Please, 3:50. 10 more minutes and we are done. If you don't want to your village people to see you, maybe you have a personal question you want to ask, please drop it in my DM. Okay? Promo price, how much is promo price? After fibroid surgery, how long does it take to undergo IVF procedure? After fibroid surgery?
3 to 4 months.
3 to 4 months. Okay. XT makeup, I can't find your comments. Please, if I'm not answering your comment, just know that TikTok is removing your comments. Maybe you used a word or a comment, or you said something you are not supposed to say, so they wiped it. If the fibroid is small, can I still do the IVF? I think it depends on where it's located. Yeah. We've been asking for a promo price, please. We cannot tell you the promo price, sorry. But definitely I'll update you guys on the promo. Definitely. How long is the duration for couple using donor eggs? I think it will be shorter for them because they will make the donor available before you come.
Within the same period of 4 to 6 weeks.
Yeah.
Okay, question. Is there a possibility to switch sperm because my husband is scared of the DNA not to interfere with embassy procedures of child ownership?
No, we don't switch. We carry out ethical processes, so we don't. That is unacceptable for me.
Okay. What if your husband is okay, but for extra success rate, can you go for ICSI?
There are indications for ICSI. There are medical indications for ICSI. So we don't just do ICSI, randomly. If there are indications, we go ahead and do ICSI.
Okay.
She did hysteroscopy yesterday here. I know.
Okay. See me see Greencare next year. We are waiting. My husband has azoospermia. Can we use the sperm for IVF?
No, if it's azoospermia, I'm sure you know what it means. No sperm cell.
At all.
So if there's no sperm cell,
Can use. Can someone bring already freezed semen at another hospital to do IVF in your hospital?
why not? You can.
Okay. What about donor sperm? Do you want to donate or you want someone to donate for you? Does high BP affect IVF?
If somebody is hypertensive, we want to control the blood pressure before
anything.
process.
Okay. Is hydrocephalus done via surgery?
Yes, that's you want to either do sapingectomy to remove the affected or damaged tube.
Okay. Please, sir, is there any solution for azoospermia?
It depends on the cause. You have obstructive and non-obstructive causes. So a urologist will need to review you wherever you are.
Okay. This one said you should talk about surrogacy.
Yeah, surrogacy is just a process whereby a third person carries the pregnancy. Now we have the traditional surrogacy and the genetic one, whereby you have the husband brings his semen, the wife gets either the wife or the donor egg, as the case may be, and then you now get somebody who will now carry the embryos to term. Of course, we know that surrogacy is has a lot of medical legal issues, and that is why for you to embark on surrogacy, either the gestational or the traditional, you need to get all your consent, via the legal process is very right to ensure that everything goes on very well. So you take care of the consenting parents or genetic parents will also have the responsibility of taking care of the unborn, of the embryos, and then of course the unborn children that will now later come up. So that's about surrogacy.
Okay, someone says, do you do sperm sorting for gender selection / IUI?
Yeah.
Okay, another question from here says, is it safe to take misoprostol after realizing you have no embryo sac growing in you and you're testing positive? Okay, we'll answer that one, sorry. So what precautions can I take during the IVF process? I already have 2 kids with autism.
Well, it depends. The 2 autistic children, were they, as a result of IVF, we need to get that history clearly so that she will understand what she's talking about.
Yeah. Okay, is it possible? How can we know the genetics of the egg donor, like height, complexion, and others?
Yeah, so before we do some form of matching, but you want to do the various baseline investigation, the phenotype, how the outlook of the donors and all that before you now match them to the desired recipients.
Okay. What if a patient is with hepatitis B?
Okay.
Can she go for IVF? She can. I think.
Yeah, why not? She can, but I mean, the embryologists and of course the health workers have to be careful too with that.
Okay, someone said, that question, let me take it again. Said, is it safe to take misoprostol after realizing you have no embryo sac growing in you and you are testing positive so that you can start the procedure again, or the gestational sac dissolves on its own?
So it's, if you have that, the best bet is to go and see a gynecologist.
Okay, another question, sir. Doctor, please, my 20 years sister has ovarian failure and she's married but no period. Is there anything to do via her fertility because her symptoms are not stopping even after taking supplements?
Well, again, that that will still require a review by a gynecologist to know what the challenge is.
Okay. And a woman of 47 years carry a donor egg successful. Yes. Do you do surrogacy? Yes. Does fibroid affect IVF? Yes.
Depending on the position.
Okay. How much does endometriosis affect IVF?
Yes. Endometriosis, yes, it can.
Okay. Please, where is the hospital? Okay, it's located at number 15 Baba Street, Rumigo, Port Harcourt. Please, if you want the contacts of the hospital, drop me a message. I will drop the number for you, okay? So we are rounding up because it's almost 4 p.m. So if you have any more questions, please, you can either come to my DM or Greencare, yeah. So just leave me a message and then go to my YouTube page, Mom of Quadruplets, and drop your questions for me, okay? This will be the end of this live. I think hopefully we'll do this soon. Hopefully. So for people asking about the promo and all those things, yeah, I will update you guys about the promo, both the price, the dates, and everything. When it's finalized, I will drop an update, okay? So, sir, please, what do you have to tell them before we...
Okay, so just to say thank you to everybody. It's been a piece. And as I said, anywhere you are, be reviewed by a gynecologist, a competent gynecologist, and then of course, even do IVF anywhere you want to do IVF. This is not an advert, this is more like a learning session where knowledge has been passed. Some people that have not really been able to get certain information, you have clarity on those information right now. So it's a good one. So I want to thank you very much.
Okay. So I'll see you guys later in the night. We'll do our normal